My husband brought me to the ER. At that point, the pressure in my head, primarily the right side of my head, was so intense that I just had to lay my head on the car window. And when he got me into the ER and I registered, the pressure was still so intense that I had to lay on his lap. My name is Eileen Miller. I'm the Assistant Vice President of Human Resources for Nuvance Health. On Thursday, December 15th, I was in my office wrapping up a meeting when all of a sudden I felt extreme pain in the back of the right side of my skull. I'm a long time migraine sufferer, so I just thought it was another headache. But in addition to the intense pain in the back of my skull, I also began to hear a whooshing sound in my right ear. So I decided to go home and sleep it off, and I returned to the office, put in a regular day at work, and then again, when I returned home Friday evening, I went to sleep hoping I could sleep off this really intense headache. The following day, which was Saturday, the headache was so intense and the whooshing was so intense that I called Dr. John Sabia, and he consulted with Dr. Andy Wilson.
Well, I remember receiving a phone call on a Saturday morning when I was making pancakes for my kids, and I saw the caller ID on my phone said Dr. John Sabia, who's now a board member at our hospital, called me and he said, listen, I just got off the phone with Eileen and her husband, and she's got some concerning symptomology. And so after putting all the dots together, we decided that she needed to be referred immediately into the emergency department just to make sure there was no vascular emergency associated with these signs and symptoms.
I was registered. They took me into the room. At that point, the Dr. Miller came in to explain to me that they were going to take me for some CAT scans. They brought me in for CAT scans, brought me back to the bed, and shortly thereafter he came in to explain to me that I had a carotid dissection and that I needed a higher level of care. Therefore, they had called an ambulance, which was on its way to transport me from Northern Dutchess to Vassar Brothers ICU.
If she hadn't gone to the emergency room, she wouldn't be at work today. In fact, I'd be worried that she'd be in either a long-term facility needing care or living with a significant deficit or even worse, death. There are two major blood vessels that go up the side of the neck called the carotid arteries. And one of these carotid arteries, essentially the inside part of the artery ripped off and closed off that blood vessel. So being young, she required the blood flow to get to that part of the brain through a different rerouting mechanism. The blood vessels essentially reroute themselves. The best plumbing system in the world is the brain. It was devised in such a way that if one blood vessel closes off, that the others will compensate for the most part.
It is a life-threatening, brain-threatening type of injury that of course needs to be evaluated. It sometimes needs intervention, sometimes it needs, pristine medical management like Eileen's case, but regardless, it needs to be identified right away because it's time sensitive.
We don't know in her case exactly what happened, which is a bit unsettling. Frequently that is associated with mild trauma, neck trauma. We see it in car accidents with flexion of the neck. People who have sports injuries actually can also contribute to this condition. And obviously there's always a question particularly in her, there was really no clear inciting factor.
So upon arriving at Vassar Brothers Medical Center, I was brought to the intensive care unit where there was a group of people waiting for me. At that point, I had a nurse explain to me that they were going to have to begin doing hourly neuro checks.
Eileen's care, she was a neuro patient, so her care was revolved mainly around the primary neurological approach. So we did a lot of neuro checks, we did a lot of blood pressure management and making sure that everything was within the parameters that the physicians had set and making sure that she was progressing with all of her activities of daily living. So we wanted to make sure that she had no deficits and she was able to be discharged fully functioning the way she came into us.
A lot of times these conditions do require for all the specialties and special expertise to put our heads together, what is the best approach to treat her? And sometimes there is not a clear pathway, this is what we should do. So we actually did discuss whether we should use a stent or a balloon to keep that blood vessel open. And it was decided as a team that may not be in her best interest.
On December 20th is the first day when I started to feel some relief and the headache started to subside. However, it was multiple days with no sleep at that point. Multiple physicians, residents rounding, nurses doing 1-hour neuro checks. And I was just anxious at that point to get home into my own bed and to get some rest. So you can imagine how excited I was when I finally was told on December 22nd that I'd be getting discharged the next day, but that I would have to remain on a blood thinner.
So since Ms. Miller has successfully made it through this acute setting, she will continue to progress and have a very fruitful life.
Overall, as scary as the experience was and unexpected, I just am truly grateful for the care that I received from all of the staff, including the physicians, the nurses, and the techs. So my message to anyone who's listening to my story is to always listen to your body and to advocate for yourself.
You know, I tell patients every day that they know themselves better than a doctor will ever know their body. So if something doesn't seem right,
When you know something is not right,
if something doesn't jive with what you think,
it's imperative that you seek care.
you need to keep going. You need to keep looking, and you need to keep investigating.
Half hour out of your day, an hour out of your day, you'll be able to find the time to seek medical care. Because the alternative means that you may be taking off significantly more time from work.
I'm happy to say I've made a full recovery, and I'm grateful to be back at the hospital, not as a patient, but as an employee.